All right, everybody. Welcome. We're going to get started now. I think people are going to trickle in as we get going, but we're going to try and start on time and finish on time. So welcome. We're really happy to be here with you today. My name is Laurie Parker, and I'm here with my colleagues Allison Peace and Theresa Jackson. And we are all members of Gather Clinical Counselling here in Victoria, BC. I think there are people joining us from all over Canada, so welcome to everybody. We work with clients of all ages, both virtually and in person. And we all come from backgrounds working in schools and supporting children, youth, and families, along with their parents and caregivers. And we are also all registered clinical counselors in BC, and we all hold master's degrees in counseling as well. Mostly, though, we're people who really care about this work and are grateful to spend some time with you today. We're hoping this workshop feels practical and relatable and supportive, and that you leave with a few ideas and tools for how to support the people in your life, the young people. And I think you'll find that a lot of the things that we talk about tonight will also apply to you personally. Living where we do, we feel it's really important to acknowledge with great respect that we are located on the traditional territory of the Esquimalt, Songhees, and Saanich peoples, whose historical relationships with the land continue to this day. So I'm going to hand it over to Theresa, who will take you through what this workshop is going to look like tonight, how we're going to structure it.
Hello. Like Laurie said, my name is Theresa Jackson. We're excited to have you join us tonight. Our presentation will be about an hour long, and we've got a few questions that hopefully we have time to answer at the end. That's what our goal is, so we should be able to tackle that. We're going to talk about what childhood anxiety looks like, how it presents, because sometimes it's a little bit different between children, teenagers, and then adults. We are going to talk about how we as counselors work with anxious children and teenagers and the people that they live with. We're going to talk about children, and the focus is on their anxiety, but tonight our focus of our presentation is to work with parents and caregivers about how we can actually help support the young people in our life with their anxiety if they're struggling with it. So you'll leave the workshop with some very actionable ideas, some strategies that you can implement right away. We've all attended workshops before where we've left and we've got a lot of information, but not a lot of strategies to use. So that's one of our goals. We'll have a lot of strategies towards the later half of the presentation. And a few housekeeping notes. I always appreciate it, and I can see people taking notes, so you're very welcome to do that. Also, we have notes already done up so that we will, if you've signed up through Eventbrite, which everyone here has, we can actually email those out to you from our counseling office. So in the next day or two after our presentation, we'll email out a series of notes with the specific strategies we're talking about. I also wanted to share that we talk about parents and caregivers, and I'm going to use those terms interchangeably tonight. We just really acknowledge that parents are a part of kids' lives, but also there are a lot of loving, supportive adults who are not necessarily their biological parents, but who are also often huge roles in these children's lives. So when we talk about parents or caregivers, please note that we're using that term respectfully and apply it as it fits for you. Also, throughout our presentation, we've organized the presentation so that it's really how to support children and teenagers that are essentially school age. So sometimes we'll use the word children or kids. Please know that we're talking about children and teenagers, and some of the strategies that we have later, we give examples that are developmentally appropriate for the ages that they are. So with that, I'm going to turn it over to Allie.
Okay, I'm going to get us started by grounding us in the topic of childhood anxiety by asking a few reflective questions. If you're away from the screen, I'll read them out to give you some time to ponder them. So what situations tend to trigger my child's anxiety the most? When my child is anxious, my first instinct is to On a scale from 1 to 10, how comfortable am I with my child experiencing anxiety or other difficult feelings? And what is one strength my child already has in coping with difficult feelings? So these questions will help identify your kid's triggers, look at how distressing it is for you to parent when difficult emotions come up, which is important because it informs how we act. And lastly, just to recognize the strengths that your child is already coming with. So with that in mind, we're going to jump in and we're going to go over to Laurie, who's going to talk about what anxiety is.
Okay, so we're going to talk a little bit about what anxiety is, and then also when do we know that it's a concern? Like, when does it become a concern? So when we talk about anxiety, it's really important to understand that anxiety itself is not a bad thing. In fact, it's a normal and helpful part of being a human being. So it's our built-in alarm system, and sometimes we call this the fight, flight, or freeze response. And that's a phrase that a lot of people are really familiar with. So it's what helps us notice danger and get ready to respond, whether that means engaging or facing a challenge or getting to safety. So, for example, a bit of anxiety before a test or a new situation, or I don't know, maybe doing a presentation in front of a bunch of people can bring that anxiety up, but that helps us focus and prepare for what we're going to be doing. So in that sense, anxiety is doing exactly what it's supposed to do. It's fulfilling its role. Where it becomes more of a concern is when the alarm system starts to misfire. So what happens here is anxiety will overestimate the danger and how dangerous the situation actually is, and it underestimates our ability to cope with it. And so the body reacts as though there's a real threat, even when the situation is really safe or really manageable. And when we start to think of anxiety as being problematic when a couple of different things happen. One is when it feels excessive, it happens too frequently, or the response that we're having to the anxiety is stronger than we would expect based on the situation that we're in. So you imagine sort of a low stakes situation where our response is really strong. That's when we start to think that maybe it might be a bit of a concern. Another is when it begins to interfere with our daily life. So whether that means avoiding going to school, avoiding social situations, feeling really stressed about things when maybe, it doesn't quite merit it. So that's another time when we're starting to avoid things, we know it might be a bit of a concern. And finally, it's a concern when the level of anxiety doesn't match the actual situation. So feeling really intense fear about something that isn't dangerous. So overall, anxiety is a normal and important system, but sometimes it gets a little too sensitive, and that's when we step in to help children learn how to manage it more effectively. So now Ali is going to talk to us about how anxiety develops.
So anxiety rarely develops from one single factor. Instead, it's an interplay of several different things that you see up on the screen. So if you have a child that's naturally more cautious or has a tendency to be a little bit more shy, those kids are just more inclined towards anxiety. If you or your child has kind of a family history of mental health concerns or anxiety, of a primary caregiver or somebody really close to the child, we call that being genetically predisposed to anxiety. So there's just a higher chance that a child will develop anxiety, but it's not for certain. And of course, any stressful life events. So stressful life events or trauma. So something as simple as moving, starting at a new school, starting at school, even something exciting that the family's looking forward to, like welcoming a sibling. And certainly harder and more stressful experiences, such as a divorce or death and other challenging experiences. And lastly, our children look to us for how they see the world. And if we are coming and looking at the world from a more fearful place, or we're experiencing anxiety ourselves, then certainly children are more likely to experience anxiety as well. I left this one to the end though, because it is not the only reason a child will experience anxiety. And if you think about ourselves and the lives we are living, we may also come from a family history or a family of origin with anxiety. Therefore, we may also have very good reason to have anxiety. We also have to parent during very hard times. Turns out life is really hard sometimes, and we have our own trauma, our own stress that is in the background as we are showing up for our kids. There's no shame here if you are a parent or a caregiver or somebody in a child's life who is experiencing anxiety. And in fact, we're all here tonight, right? And we are going to be talking about evidence-based parenting strategies that help move the needle a little bit on this one. So I'm really excited and looking forward to getting into the strategies with you tonight. I'm going to lead it or pass it over to Theresa.
All right. So I'm going to talk about what anxiety looks like in kids. There's some overlap between what it looks like many of us are familiar with having an anxious moment as an adult and what that looks like. We can think about kind of spiraling thoughts or a racing heart. We can identify the feelings in our own selves, the physical sensations in our own selves, but sometimes it looks a little bit different in children or teenagers. So some different types of anxiety and how it might show up. Separation anxiety is often the first type of anxiety that parents or caregivers might come across. When kids are really little, that might look like trying to pry their fingers off your leg and, their tearful goodbyes as you're dropping them off at school. That's not uncommon that parents are told later, oh yeah, they had a great day, no problem, as soon as you left. But it's still, there's that moment of distress when there's that separation that's about to happen. This happens in teenagers too, of course. Sometimes that might look like pulling up somewhere to drop them off and they don't want to get out of the car. So, this is not just for little children when we think about starting school or anything like that, but it can show up in many different ways across all of childhood. Social anxiety is also another type of anxiety that children, teenagers, and adults can experience, especially if you may not have had a great example or there's some self-confidence struggles going on. Social anxiety is fairly significant for a lot of kids that we work with. Generalized anxiety, that's anxiety that shows up and it doesn't have a specific cue for it. It's just kind of the overwhelming kind of background noise almost about that's playing in their lives. So sometimes there are some peaks and valleys with it, but there's not anything that it necessarily attaches to that's very specific, like social anxiety or separation anxiety. Phobias, fears are very specific types of anxieties that people can experience, children, teenagers, and adults, where they don't experience a lot of anxiety about something, but one particular thing might give them quite a bit of anxiety or distress. So, for example, we often work with kids who are struggling with, it's not uncommon that I hear about kids who have a big fear of spiders or something like that. But more commonly over the last few years, also I've been talking to children and teenagers who really struggle with a fear of throwing up, for example. So those are examples of very specific incidents that cause anxiety. And then sometimes we are helping kids navigate when they're having panic symptoms. So it might not present in that way that anxiety might show up for them, but it might be more of those peaks that I was talking about, where it's quite significant panic that happens when they're feeling quite anxious. So all of that to say, it can show up in different ways for kids and teenagers. And just because you might have social anxiety doesn't necessarily mean you might not also have generalized anxiety. Sometimes these things work in clusters as well. So what does it look like? So as I alluded to at the very beginning, as adults, we can kind of figure out what that looks like as an adult, having our own adult experiences with things that make us feel anxious. But for kids, it can show up a little bit different. So thinking about physical symptoms, sometimes it shows up as stomach aches or headaches or really struggling with sleep. So they're presenting and they're telling you, my stomach hurts, my stomach hurts. And so you're trying to figure it out medically. If there's something wrong, we start looking at diet. But sometimes those physical sensations are actually a manifestation of their anxiety. Emotionally, we can think about feeling nervous or scared, but also other ways that it can show up for kids. It can show up as irritability, it can show up as anger, fear, feeling really overwhelmed or flooded. And then behaviorally, it can look like avoidance or really excessive, almost reassurance seeking. Like, I can do this, right? You think I can do this? Will it be okay? And doing a lot of checking to just seek that reassurance for themselves. And as a parent myself, I can tell you sometimes it shows up as meltdowns where for some reason, my jacket is the wrong color or my socks don't match, or I can give a whole bunch of different examples, but that whatever triggers it can just escalate and then looks like a meltdown where they're kind of crying and inconsolable. We talk about that stuff because, to give context to it, most adults have heard of in anxiety, it's a fight, flight, or freeze response. So when we think about, animals out in the wild having a fight, a flight, or freeze response, that kind of makes a little bit more sense, picturing a lion out on the savannah or something. But in children, if you think about, where they get really angry with us because you didn't pack the right thing in their lunch, or they're reassurance seeking, or they're withdrawing. Some of those you can hear, fight, flight, or freeze, those responses actually fit right in those categories. So it's just being really curious and looking at some of the ways that it can manifest that aren't necessarily the ways that we think it might manifest for us as adults. And now I'm going to turn it over to Laurie, who's going to talk about the anxiety cycle.
So we've got up on the screen something called the anxiety cycle. And anxiety tends to follow a pretty predictable pattern, which can be very helpful for us. It starts with a trigger, and then it moves into worry, physical symptoms, avoidance, and then into sort of a temporary relief and a stronger anxiety later. So if you follow along with me, we're kind of talk this through. So one thing that's important to know about avoidance is that it can lead to short-term relief, but it tends to get stronger later when you're in a similar situation. So understanding the cycle helps us to see why anxiety sticks around and how we can begin to break it. So we're going to start with trigger. So a trigger is when something sets off your anxiety, and this can be internal or it can be external. So external might be something like there's a test coming up. A child is about to sleep alone for the first time. Maybe they're invited to a birthday party or something like that. Or it can be internal, which means that it's the thoughts that are going on in someone's mind. So it could be a thought like, I don't feel like I'm very good at gymnastics, or I feel like my friends don't like me. So that's an example of an internal worry. So for example, just to take one example through this whole process, imagine that a child is told that they have to present in front of the class. Okay, so that might be a trigger and gets them into the next step, which is worrying. And I think we can all kind of relate with what worrying feels like. But this is when we start thinking about what can go wrong. And so, as I mentioned before, anxiety overestimates the danger and underestimates our ability to cope with it. So something, an example of what a child might be worrying about is, I'm going to mess up. I've got this presentation at school. Everybody's going to laugh at me. I can't do this. I don't feel prepared. So this is where those worries start to come in. Then that's going to lead into physical symptoms. And again, when you are in that state where your body is reacting as though there's something really dangerous happening, you get all of these physical symptoms that can come up. It could be a stomach ache. It could be a headache. Your heart could start beating really quickly. You get a little bit sweaty and flushed. And that's, if you can imagine, in a situation where something really dangerous this is happening, those kinds of things are putting you in the state, that fight, flight, or freeze, to like get going, and something can maybe happen from this. So for an example, with this child who's got a presentation going on, maybe they start to feel sick to their stomach, and that's how it's showing up for them. Then comes avoidance, which is the next step. And this is where the child tries to soften or escape or avoid the situation. And so this might look like refusal, to do something. It might look like procrastination, where they're trying to kind of put it off. Or they may actually be asking for reassurance in a situation where they feel like, okay, I don't know if I can handle this. But they're wanting to avoid engaging with whatever it is that's making them feel this worry. So maybe in this case of the presentation, a child may say, like, I want to stay home from school today, or I don't feel well, so I need to stay home today, so they don't have to do it. Now, the next one is temporary relief. So when you are in a situation where you're really worried about something, you're feeling these physical symptoms, as soon as you're told that you don't have to do it, you get this massive sense of relief. It's like, oh, okay, I've avoided something. I don't have to do it. And so those feelings of anxiety go down. So staying home means they don't have to do this presentation, and then they feel a lot better. So then this leads to the stronger anxiety later, because when we've gone through this whole cycle, what the brain learns is avoiding kept me safe. And that's the message that your child is getting, and that their brain is getting. And this reinforces the anxiety and makes it more likely to happen again. And then the next time it happens, it could feel even more intense. So, they avoid, they get to stay home. They're not doing the presentation at school. They feel even more overwhelmed the next time it comes up. So, little summary. Avoidance will tend to bring that anxiety down in the moment, but it strengthens over time. And this is where it's important to remember that helping kids face their worries and their fears gradually is what will help to break this cycle. So now we're going to look at parent and caregiver support with Theresa.
All right. So some things that we just hold true as we talk about this work tonight, but also in the context of our counseling work, is we really do believe that parents and caregivers are usually doing the very best that they can. It is challenging sometimes to parent a child in this day and age. We have our own stressors. The world is a bit more complicated. Kids hear a lot of stressful stuff just through our news. So it is complicated being a parent, but we really do believe that parents and caregivers are usually doing the very best that they can. It's also normal that people feel exhausted, they second guess themselves, they feel guilt, they might feel pressure. But we always go back to, if people are showing up and they're trying, they're doing a great job. We also believe a child's behavior or emotional outburst is not a measure of your parenting. Sometimes it's easy to look at our kids and see that they're really struggling with something and wonder what we've done or what I should have done differently. Or, parents get this all the time. It's really easy to think about, oh, that coffee I had while I was pregnant, or, oh, I should have said that differently. We all make mistakes. That's a normal part of parenting, but having some grace for ourselves is very important. And again, going back to a child's experience is not a measure of your worth or effectiveness as a parent or caregiver. I talk about in our counseling work, I talk about being a mirror for our kids, but also having some boundaries with that too. My background before I was a counselor was I worked in neuroscience. So I always like to talk a little bit about neuroscience with this. When kids are born, they're born with a set of neurons in their brain called mirror neurons. And so, for example, as if someone watches me reach over and pick up a cup, the neurons that fire in my brain are mirrored in their brain as well. It's part of the reason why we can learn and how that shapes our behavior. So we are truly a mirror for our kids. They're watching us all the time, no pressure, but they're watching us all the time. But also they're not us. They're not just an extension of who we are. So we have to remember our boundaries with our children as well, because they come with their own set of experiences. They are not just a photocopy of who we are. So we have to remember that. But while also being mindful that some of how we react is how they're learning to react as well. And I talk all the time about, when I work with parents, I talk about regulation and co-regulation. So the idea of regulation is that it is being able to keep yourself calm, grounded, neutral, comfortable, feeling emotionally regulated. That's what I mean when I use the word regulated. There's a psychiatrist out of UCLA, and he talks about emotional regulation and co-regulation. So I'm just going to give a quick example here. So if I'm using my hand as a model of the brain, the fingers on the outside represent the folded layer of the cortex that is on top of the brain. So when we think about what a brain looks like, if you've seen an image of it, that's kind of the like folded, wrinkled part of your brain. So that's the cortex, and that's the most, that's kind of the newest part of our brain that develops through evolution. And a lot of that is where our complex higher order functions happen in our brain. So, in our frontal lobe, this part of our brain, it's higher level reasoning, planning, organizing. Underneath, in the middle of our brains, is it's an older structure that we all have called the limbic system. And the limbic system is really responsible for some emotional regulation, threat response. It's what's actually helped us keep us alive, keep our ancestors alive so that we're here tonight. And that it's a very effective system. It's a wonderful system, but sometimes what happens is, living in the society that many of us do, we don't actually need to have a strong limbic response to most situations. For example, while we're driving or a math test or whatever that might look like. So using my hand model again, what can happen is, if we're in a regulated state, we're calm, grounded, and we're using our cortex a lot, that higher order functioning. And then according to Dan Siegel, if you become really dysregulated, he calls it, you flip your lid. And what he's talking about is you're actually using a lot of your limbic system and responding from your limbic system at that point. So it's being dysregulated. Now, all this factors in as parents and caregivers is that if a child becomes really upset, they're having a meltdown, many people can spot what that actually looks like when they're dysregulated. So they are really regulated. They flip their lid, they're responding from their limbic system. Parents have a few choices. One, we can flip our lids too and become really dysregulated. And then you have two very dysregulated people who are responding from that very emotional state. Our job as parents and caregivers, ideally to the best of our ability, is to either regulate ourselves first and keep calm and grounded. That's where we're making our best decisions from, is that higher order functioning from our cortex. So it's to regulate ourselves first and encourage the child to help regulate. We help them regulate themselves, or we can regulate together. But one thing that does not happen is if we're both feeling dysregulated, it's that the child can regulate themselves first, and then we calm down and regulate ourselves. So I always give that as an example for parents, because one of the most effective strategies when you're in a situation where there's a lot of intensity, a lot of anxiety and dysregulation happening, it's to actually work on keeping yourself as regulated as possible, because your child cannot actually regulate themselves until you are regulated. So it's just a reminder about our experience actually directly impacts the experience and how they can adapt. All right, and now I'm going to pass it over to Allie. Is going to talk about accommodating anxiety.
Okay, so accommodations, when we're talking about anxiety, are the actions we take as caregivers that help reduce kind of these big emotions in the moment. And they are something that usually start small and they gradually build over time. So these are things like your child asks you to check their homework at the end of the day a couple times because they're not sure if they've got the assignment right. And then you wake up one day and you realize you've been checking that homework 4, 5, 6 times a night, every night, and it's still not really scratching the itch. Or this is your teen maybe not liking to put in an order for food, so you do it for them. But you also notice now when you're in public, you're speaking on their behalf all of the time. So they just struggle to speak up, so you do it for them. And if you don't, it's kind of this big anxious spiral happens. Or another example might be you answer all non-emergency texts and phone calls throughout the day. So you always have your phone with you and you're answering all those calls and texts, even when they're not an emergency. And so you're interrupted in your day while you're at work because you're answering these phone calls. So these, again, this is the slow burn of an accommodation where it starts with really good intention and it gradually grows and enhances the anxiety and actually reinforces it. And again, this isn't anything the child's doing. This is what we are doing as caregivers or parents that is very well intentioned. A lot of the things we talk about too at our practice when we're speaking with parents, myself included as a mom, is a lot around bedtime. And somehow this kind of grandiose repertoire of things has kind of come to be as like how you have to put your kid to bed in order for a meltdown not to happen. So again, they're really well intentioned, but they tend to reinforce the anxiety. So if you look at that chart up there, the goal is low accommodation, high support. So low accommodation, high support. So high support, high accommodation would be telling your child, you are so confident they've got this homework assignment down pat. It's all good. You know they've got it. And then you check their homework for them because they're anxious. So you check it that 4 or 5 times. The child can be left feeling, well, my mom said I had this and that she's confident in me, but she's still checking my homework. Maybe there is something that I'm not quite getting. She has to double check for me. That's high support, high accommodation. Low support, low accommodation is, you either get your homework done or you don't. I'm getting in the car and I'm driving to school. Or you can order your food or not, but if you're not going to order it, you're not eating. So that also comes from a really well-intentioned place. And we really want to raise self-sufficient kids, right? We want them to stand on their own 2 feet. So sometimes we can kind of reduce all the accommodations and all the support to try and get them to do it themselves. Often in that scenario, kids their behavior can actually escalate or their anxiety can escalate as a way to communicate their distress to you. And in the first example I gave of high support, high accommodation, children can be left questioning themselves. So again, if the goal is high support, low accommodation, the way that goes is usually you start by mapping out or taking an inventory of the accommodations you're making as a family. So what is it with a slow burn approach where you kind of wake up and you realize, okay, here are the things I'm doing that are a series of behaviors on my part as the parent that are helping in the short term, but I can tell that they are not helping in the long term. So you map those out first, and then you figure out how to convey support to your child. And we're going to get into that right now in a second. So you learn how to craft a supportive parenting statement. And then lastly, you start to gradually reduce the accommodations. So let's just move right on into how to show your child support, because it's great if you're reducing those accommodations, but in order to support your child, they need to feel validated and that you have confidence in them. So we like to think about this as macaroni and cheese. So it's a recipe. There are 2 ingredients in order to get a supportive parenting statement. And those ingredients are the macaroni and the cheese. It's just a kind of a nice way to remember it. So if the macaroni is acceptance and validation, oh, I know this is so hard for you. Then the cheese is the confidence in the child. And I know you can handle it. So we don't want macaroni. That would be, oh, this is so hard for you. I can see you're really struggling. So we're sitting in just validation. And while that might feel really validating to the child, we can also feel a little stuck, or it keeps that behavior around, right? That keeps that anxious behavior or the avoidance around. We don't want cheese and cheese. So we don't want, I 100% know you've got this. You've done it before and you'll do it again. That sounds really encouraging. And we know as parents, we do have to encourage our children, but it also can come across or read to a child as dismissive. And so again, in order to communicate distress, their behavior actually might interestingly get a little bit bigger. So we want macaroni and cheese. We want, oh, I know this is really hard for you, and I 100% know you've got this. So that leaves the child feeling like they are heard and understood, and also that you have confidence they can handle it. So that's macaroni and cheese. And when we think about what this is doing, you might not be met with a response from your child of, oh, thank you. Yes, okay, I'm going to go do that hard thing. I'm going to go order my Starbucks drink, and I'm not going to put it on, on the app. I'm going to go do it. No, instead, we're looking at more of a long-term focus. We're creating our child's self-talk. The way we interact with our children is what becomes that internalized dialogue that they have in their own minds later in life, in part. So we are really looking at the long-term process of creating that self-talk. We also, when we are looking at supporting our children and removing accommodations, we want to make sure that we are supporting them with healthy thinking, and that we are also supporting them in their bodies, because anxiety lives in the body. So a little bit later tonight, we're going to talk about some body strategies. And right now we're talking about helpful and healthy thinking. So I'm going to pass it over to Laurie for a strategy for the mind.
Thanks, Allie. So as we move into some strategies to support anxious kids, it's helpful to remember that anxiety doesn't just show up in the body, it also shows up in the mind. So we're going to talk about two different strategies today. Children's thoughts can quickly become overwhelming, and then it often fuels the anxiety that they're already feeling. So you get into a little bit of a feedback loop. So we're going to look at some practical ways to support children in understanding and responding to their anxious thoughts, and how strategies like this can help them feel like they've got a little bit more control in the situation. So the key is to practice this and some of these strategies when your child is not highly activated or highly anxious. So they're easier to use in a moment when they are feeling that way. So I always like to use the analogy of a fire extinguisher. So fire extinguishers are a little bit complicated. You have to know how to use them. The time to learn how to use one is not when the cookies in the oven are on fire. That's a terrible time to learn how to use it. So what is best is to learn how to use it beforehand, so that when that moment comes when you need it, you're feeling really confident about how to use that skill. So not teaching these to your kid and not reviewing them in those anxious moments will be very helpful in that way. So one helpful strategy that we often use with kids comes from Dr. Dan Siegel, who Theresa was talking about a little while ago with the flipping the lid. And it's called Name It to Tame It. So the idea is that when kids can put their feelings into words, it actually helps to calm their brains down. When emotions stay unspoken, they can feel bigger and more overwhelming, but when we name them, they tend to become a little bit more manageable. So what's happening underneath this is that strong emotions are largely driven by the more reactive parts of our brain. So when we put those feelings into words, we engage a different area of our brain responsible for language and thinking, which helps to bring those big emotional responses down to a more reasonable and manageable level. So for example, instead of a child just feeling flooded with emotions or melting down, we can gently help them to label what's happening. So some examples, it looks like you're feeling really worried about going to school. Or you could say, I wonder if your body is feeling scared right now. Or that seemed really frustrating. Did it feel that way to you? And even getting your child to the point of being able to say, I'm feeling nervous, or I'm afraid that something will go wrong, can make a big difference in having them sort of take it from that place of being something that's kind of just this feeling to something that they have a little bit more control over. Younger children often need a little bit more support in being able to find the words to express how they're feeling. So a couple of strategies for this are offering some guesses. So you might say, I wonder if you're feeling angry that Simon isn't coming over. Or it seems like you're feeling really scared to try gymnastics. Using really simple feeling words can also be helpful with younger kids. So sad, worried, mad. There may be words that you use within your family to say how you're feeling. And so employing some of those simpler feeling words might be helpful. Some people also with younger kids, pointing to a feelings chart. So you might have one, I know they're available all over the place, where there's sort of the feelings in the green area that are sort of the better feelings, and the ones that are in the yellow area that feel a little bit more challenging. And then the ones in the red that feel like they're those really big, worry, frustrating ones. So whatever works for your child, it's nice to employ a couple of different strategies. Older kids and teens can often do this themselves, especially if they've been exposed to this over time and they know how to name those feelings and identify them. So even, like eventually they may say things like, I'm really anxious about this test, instead of just shutting down or avoiding something. So you may see some results that way. It's also important to keep your manner and your demeanor to be, gentle and curious, not really being really certain about something or correcting them. So phrases like, I wonder if, or it seems like, are really helpful in cases like this. And you can leave room for your child to agree or disagree, or to sort of refine what they're feeling. So you're not labeling it for them. You're giving them some options and just saying, are we getting it? Are we getting there? Are we close? The goal isn't to get it exactly right. It's to help them start noticing and describing what's going on for them inside. So over time, this builds that emotional awareness and that feeling of control in the situation. And anxiety is very much a feeling for people that they aren't in control. So bringing that feeling into a situation can be really helpful and calming. So instead of being swept away by big feelings, children can start to recognize that this is anxiety, and that alone can make it feel less overwhelming. So that being said, some children find this process really uncomfortable. They might feel exposed, misunderstood, ashamed. They may even respond with some anger. They may shut down, or when you suggest that they might be worried, they might, even yell out like, no, I'm not. So you may get a really strong emotional response from them. And if that's happening with your child, it doesn't mean that the strategy is wrong. It just means that maybe we need to approach it a little bit more indirectly and something that feels a little bit safer for them. And part of that too just comes with practice. The first few times it may feel uncomfortable, but as it becomes something that you do more, it's something that they become comfortable with, and they know that, okay, this is how we manage these situations. We go through this and we try and identify what we're feeling. So there's a few alternatives if it feels like it might be a little bit more challenging for your child. And one of them is modeling it yourself. So for example, if I had a really big meeting at work that I was, feeling a little bit anxious or nervous about, I might tell my child about that and say, I'm noticing I'm really feeling a little bit nervous about this meeting that I've got at work today. I think I just need to take a really deep breath. So you're showing them that everybody feels this, everybody has ways of expressing it, and that's really a positive way of modeling it for your child. Sometimes you need to just narrate it neutrally. So maybe your child gets really upset when you ask them, are you excited to go to the birthday party tomorrow? And they have a really strong reaction to that. You could say, whoa, that was a really big reaction. Something didn't quite feel right there. So you're just sort of identifying that you're noticing it, but allowing them the space to sort of just like answer the question or tell you how they're feeling about it. Sometimes using third-party examples. So maybe you start to talk about what's going on for characters on a TV show or in a book that you're reading. You could even employ the pets in this situation or siblings. You could say, Fluffy is really nervous to go outside today. I wonder if she's afraid she's going to see a dog. So this is a way that you can just sort of put it out there and model that with other people in the family or characters that are, in your kids' books or movies or things like that. And another way is just to focus on the body before you focus on the mind. So you might, notice that your child is clenching their hands, or they're maybe curled up in a little ball or something. So you can just name that as well and say, your hands are really tight right now. It looks like you might be feeling a little bit stressed. So the key with all of this is to just reduce the pressure. When a child feels safe and they don't feel like they're being judged, they become more open to exploring their feelings. So with this small shift, just helping them name what they're feeling, it can be a really powerful first step in helping them manage their anxiety, especially when it's done with patience and curiosity. So now we're going to go over to Ali, who's going to talk about another technique to support the mind.
I'm going to talk about externalizing worry. And this is really about just creating a little bit of distance between the child and the problem. The creators of narrative therapy, Michael White and David Epstein, would say the problem's the problem, the person's not the problem. So with that in mind, we're really, again, just looking at creating a little bit of distance. So it can be as simple as saying, worry showing up for you, or you're feeling a bit anxious, instead of, oh, you're anxious again. Is whatever you can do that sounds more you and less Allie. I've worked in middle school for over a decade, so sometimes my examples are very middle schooly. So in any way you can, creating that distance. And this allows the kid to have a little bit more curiosity. They feel less shame, and it can be more playful. And because the child doesn't have to be the problem anymore, and you're not solving them the problem. Instead, it's the problem that you are working on together as a team. If they're a bit younger and their personality or temperament allows for it, you can be more playful. You can give it a name. You can draw it. You can give it characteristics. It can be Wanda the worrywart showing up because you're doing a new activity tomorrow. And of course, Wanda is going to be, showing up right as you go to bed the night before Taekwondo starts. And you can start to kind of just be more playful, and because, anxiety gets very serious very fast. So this, again, can be as simple or as kind of complex as you want to make it, but it can be a nice way just to start to have the child feel a little bit more relaxed when they're talking about their anxiety. Okay, I'm going to pass it over to Theresa to talk about the body.
All right. So as we were talking about earlier, anxiety isn't just thinking about or feeling that we're feeling anxious, but it also shows up in the body. It's a physical, biological response that people are having as well. So it can be really helpful if you think about it in that context, figuring out ways that we can work with anxiety in the body as well. You can see how really important that is. One of the things that we encourage people to do is be a detective about your child, because every kid is different. And of course, as they grow across their lifespan, this stuff shows up differently for people too. But we encourage parents and caregivers to be detectives about what's happening for their child. Allie gave an example a minute ago, or Laurie did about, you notice their hands curling into fists. You can see some of those physical cues. We want to use those cues and also feed that back as into like, how can we be detectives and figure out what strategies are going to work for our kids. So TIPP it's an acronym that's used in dialectical behavior therapy. And it stands for temperature, intense exercise, paced breathing, and progressive muscle relaxation. And so this is really helpful to remember when someone is experiencing some distress. So we don't just do this all the time. This isn't our go-to thing when our children are having like a mild moment of anxiety or feeling some worry. We want to think about this when the meltdown is happening, when they're really upset, there's some big feelings happening, and you can see physically that they're experiencing anxiety that way too. So temperature, for example, and just as a little tip about tip, it also works for adults very well too. We can use these strategies for ourselves too. So temperature is changing what your temperature is. So often when we're feeling really anxious about something, most people run a little bit hot. Part of that is because your brain is signaling to increase blood flow to your muscles. So without our planning or having any say in it, that's what's happening. So most people feel really hot when that happens. So taking off a sweater, going outside if it's cooler outside, running hands under cold water, something like that, very effective. Intense exercise, jumping jacks, running on the spot, something that gets your heart kind of going and is using your body in a really intentional way. Paced breathing is one that often parents know, and kids actually know this because it's being taught in a lot of schools. So we see kids, as young as 5 or as old as 18. Usually at some point they've heard of balloon breathing at school. It's the idea of paced breathing where you're being intentional about breathing in and breathing out in a controlled, slower way. There are lots of different ways of doing this. Balloon breathing is the idea that as you breathe in, you fill up your stomach. So you're expanding your lungs, and then you breathe out, and you're doing it slowly and intentionally. One of the big takeaways from this is you want to breathe in for a shorter period of time with a longer breath out. It's a nervous system cue that you can kind of like slow down. It's signaling to your brain, I'm safe, I'm okay. Progressive muscle relaxation has been around for a really long time. It's very effective for adults. If you ever struggle with sleep, it's very effective for falling asleep. It's an exercise where you focus on different groups of muscles throughout your body. The way that I teach it is starting with hands, moving up arms, and then head and down to feet. Some people do it the opposite way, but it's tensing body parts and then relaxing them and doing it in a really controlled manner. It usually takes about 10 or 15 minutes to learn this exercise. And one of the things that we've done is in the notes, we've actually got a link to some sites where there are a bunch of them on YouTube. You can go and watch them. And again, it's really good for adults to do as well. So again, thinking about supporting the body, we're also talking about movement. So movement is, as I was talking about earlier, jumping jacks, going for a walk, going for like a fast walk, sitting in a chair and scooting along with your legs, dancing, stomping or shaking. What you're doing is you're harnessing your nervous system's response to anxiety, which is telling you fight or flight usually are the two things. And so we're actually letting the body move and work some of that, engage in some of that process and burn off some of those stress hormones that come along with it. And then body-based strategies. This will all be in the notes as well, but body-based strategies are really interesting, especially we often work with occupational therapists who have a lot of these strategies at their disposal as well. So it can be heavy work, like a weighted blanket or stuffy that's really helpful, or weighted work like a child doing the wheelbarrow and you've got their feet and they're having to push themselves that way, pushing a basket full of laundry, doing push-ups against the wall. Again, good for adults as well. So doing something really heavy and intentional with your body or increasing the pressure on your body can feel really helpful at that when you're in that dysregulated response. And also some sensory stuff too, like thinking not just about the sensory stuff like increased pressure, but also chewing crunchy carrots, chewing a piece of gum that really you can really move those muscles, crunchy pretzels. A tip, something that teenagers really love is sour gumballs. Also because of the sensory input of the sour plus chewing the gum is often really pleasant for people. So the big takeaway for this is observe your child and see what they kind of figure out what will work best for them. And then there's so many body-based strategies to draw from. And again, they will be in the notes, so no pressure to write them down. I also always encourage parents and caregivers, work with your child, work with your teenager to figure out what will work for them. It's really popular. We always have Nido cubes in our clinic. We've used them for years. They're hard to find now, but even stuff like that, like kids are very familiar with these. So talk to your children and come up with a toolkit that they can also draw from, because we're teaching them to access these resources on their own as well. All right, so I'm going to pass it over to Allie now, and she's going to tie it together with a framework that we all really like.
I also just want to mention that we're about 5 minutes to 8 o'clock, and we've got a little bit of content left. This is the last chunk, and then we'll move into just some wrap up and some questions. So we might go a little bit over the time, but not much. Please excuse yourself at any point that fits for you, knowing that there's a recording available to you after. So this model, the 3 R's, it was developed by Dr. Bruce Perry, and I love this model for a lot of reasons. One is it's a sequential model for how to engage with your kid when they're having a hard time, meaning you have to do this, then you do that before you do the last thing. So you start with regulation before you can get into relation, and then you get into relation before you go into reasoning. It'll be clear in a second. Another reason I like this model is because we are often confronted with our child's behavior or big emotions, and we are called to know what to do. And so sometimes we'll try something and it's not working, and we get met with that kind of bigger reaction. So this model also gives us a little bit of feedback and redirects us to where we need to go. So we start with regulation, and Theresa talked a lot about this earlier, about that co-regulation. So before you head into that arena, so to speak, try and regulate yourself. And I mean, for me, what I used to regulate myself last week or last year, it doesn't really cut it anymore. So it's a constant learning process for myself as a parent to come up with new strategies of how I regulate. Do I need to take a break and a deep breath? I mean, that's the kind of base layer. And, you know, at this point in my busy family life, the bathroom has a lock on the door. So going into the bathroom, taking a deep breath, and just giving myself a little pep talk, and trying to engage that curious mindset. Like, I wonder what's going on for my kid, instead of, what's going on with my kid? And so just trying some of those regulation strategies for yourself, maybe a little bit of movement if you can do it, some of the strategies that Theresa talked about, and then entering into regulating your kid. And we are detectives, as we've talked about tonight. So trying some of the things that maybe work a little bit for your kid. Do they need your company, or do they need distance? Do they need a distraction, or do they need to be engaged in what's going on? So again, spending the time on regulation. And then this is really about communicating safety to your kid. And once you have a sense that they're starting to regulate, then we can move on to relate. This is the human to human kind of component. This is the connection. This is, tell me what's wrong. And actively listening, not to problem solve. I jump into problem solving, and I think a lot of parents have a tendency to just jump right into problem solving as the first strategy, because we want them to learn from it, right? This can't all be for nothing. And we want to set the boundaries and do all of that work. But it's not time for that quite yet. So again, we're actively listening just to understand and not to fix. And you know, when a child doesn't feel heard yet, their feelings will often get bigger, or their behavior will get bigger. So after we feel like we've been able to relate, you also at this stage might be able to offer soft eye contact now that they're regulated, or like a hand on the shoulder, or a little cuddle, if that's the way your kid interacts with you. And if you're met with, you know, that soft eye contact and they go, "Don't look at me," or you put your hand on their shoulder and you're being such a loving presence, and they swat you off, or they're physical, that is where you are getting feedback that, in fact, they might have looked like they were regulated, but we need to just move back into the regulation zone. So you haven't done anything wrong. Give yourself grace, but moving back into regulation. So again, you've regulated, you're in relationship again with your kid. And then reason. Reason is the long game. I said earlier that we like to problem solve as parents, and we like to figure things out. That's this box here. It's often not in the moment, right? It's later that night. It's even on another day or next week. This is also what we do in counseling. We help families and children come up with strategies and problem solve. So when you do get here as a parent, this is let's figure this out together. This is where we can talk about our boundaries, we can talk about our expectations, but we can also strategize together to figure out what's going to help our kid. So again, give yourself grace. Even when you get this like bang on 100%, it doesn't always feel like it works. But what you're really looking for in this model is to know, what is the time for now? So I hope that ties everything together, a little bit of what we've talked about tonight. And now we are going to hand it over to Theresa.
Thanks. We're noticing that we're at time, so we don't want to, we'll find a fine balance of going through some of this a little bit quicker, but not too quick. So a bunch of questions came into us about how do counselors, how do we actually work to support families? So we take a developmental approach with whoever we're supporting. Our clinic sees children, teenagers, adults, and even I also see couples as well. Several of us see couples. So the way that it works with children is children, it's really hard for younger kids to sit and actually just talk about their feelings. Sometimes you have kids who are very primed and ready to do that. But for really little kids, we often use play therapy and other expressive approaches, including art therapy. We have a fantastic art therapist on in our clinic who works exclusively with children, teenagers, and younger adults. Teens, typically we use talk therapy and art therapy with them. Again, being able to express yourself through a different medium rather than just sitting and talking about your feelings can really bring out a different layer of insight into what's going on for them. So teens often really like both talk therapy and art therapy. And then as parents and caregivers, this is a question we often get. So when kids are coming or teenagers are coming to our clinic, we do parent support sessions with parents as needed or as we agree upon, where we're not telling them what we talk about, obviously, with their children, because we really respect kids' autonomy and confidentiality, but we're working with them to give support to them directly about how they're showing up, some of their own goals around their parenting. 3 of the people in our clinic are also trained in the SPACE program. It stands for Supportive Parenting for Anxious Childhood Events. And it's it's an evidence-based, it's researched by a professor, it's created and researched by a professor at Yale University. And the really cool thing about the SPACE program is that it is designed for parents or caregivers to attend, and your anxious child does not actually need to come to any sessions. So it's a counselor who's actually working with the adult. And it doesn't have to be, if there are 2 parents or caregivers, it can just be one of those people. So it's really cool because it's one of the first programs that in 20 years I've heard of where you're working primarily with the parent or caregiver rather than having the kid come in and engage in the work. So that's really cool. 3 of us are trained in that. And then, of course, we never want to forget parents and caregivers are people too. We're often in that sandwich generation where, we might have older people in our lives that we're supporting or thinking about, and also younger people like our kids in our lives. And so it can be very stressful. People actually specifically ask, we do offer free consultations. All counselors should offer free consultations for you to have the ability to connect with them and see about personal fit and talk a little bit about what your goals, and a counselor should be able to tell you if that is a good fit with them and if your goals are appropriate work for counseling. So I will pass this along to Laurie.
All right, so as we're wrapping up, there's just sort of a little slide here that goes over some of the things that we covered today, some of the key takeaways. So I also just want to leave you with the thought that anxiety isn't something that we need to eliminate. It's something that we can help to learn or to help them navigate. It's the small moments that matter the most. So pausing to regulate before reacting, taking a moment to connect, helping your child put words to what they're feeling. These aren't big, complicated strategies, but they're building a foundation that can be very powerful to move forward and deal with the things that are going on for your kids. You won't get it right every time, and you don't necessarily need to. What matters most is that your child experiences you as a steady and supportive presence in their life, especially while they're trying to figure out their feelings and sort of what's going on for them. So often, as everybody kind of talked about tonight, often that work starts with us becoming aware of our own responses and our own patterns and how we show up in those moments. So if you take one thing away today, I hope that it's that you don't have to fix your child's anxiety, but you can help them feel safe enough to face it. And now Ali is just going to talk a little bit, because this is often a question that people have of sort of like, what's next, or what can you do next?
So we have a few thoughts there on if you're looking to continue on in this topic and continue learning, some questions or some things you can try at home. And at the end there, you'll see that we offer, as Theresa mentioned, complimentary 20-minute consults. And there's a QR code if that is something that interests you. And often that can be helpful if you're just wanting to individualize some of these strategies or try them with some support.
All right. We had some questions tonight, but in the interest of time, because we do really try and respect people's timelines that they have. I know often kids are going to bed, or you might actually have some personal time at the end of the night, which is great. We will take the questions that we received and we'll actually type out the responses and send them along in our email to you. We wanted to thank you for joining us tonight. We're always excited to talk about how people can help support young people. We do a lot of that work in our office. We also really appreciate, though, that parents and caregivers, we might see kids once a week or once every 2 weeks or something like that. But parents and caregivers are the people that actually see their children all the time. And so it's very exciting for us to present something like this where people can take strategies and help support kids. So thank you very much. Our work is informed, as you can see. We've tried to give some information there about where we draw from. And also, if you would like to find out more information, we do actually have a website and we have an Instagram account. So there's some information there that you can follow because we do post blog posts. We have a mailing list where we send out, we are never interested in spamming people. So once a month, we actually send out a newsletter with some of this content. And on our Instagram account and Facebook accounts, we actually regularly post information about this topic as well. I just saw a question that came in the feed. So we'll take that question and we'll actually add it to our responses that we send out. But if you have any feedback, if you have any questions, we're very happy. Please connect with us because we love talking about this stuff. So on behalf of Ali and Laurie, thank you very much for joining us tonight. Take care. Thank you. Good night.